Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at what number?
The number to the studio, talk to me live right now, is 866-870-5752. Run and get your pen, 866-870-5752. And if you want to reach us after the show at my office, there are people there now, 800-300-9300. You can go to the website. If you want to watch me doing videos or email me, that's www.lastemcells.com. And Nita, if it's okay with you, I'd like to go to Tony about his low back pain.
Let's do it.
All right, Tony, Dr. Marc Darrow. How old are you, my friend? Tony, are you with us? Hello, Tony.
Tony, if we lost you. Okay, so tell you what, Tony, give us a call back at 866-870-5752. We'll pick you right up.
Mercury's in retrograde. What are you going to do?
Oh, how much longer is that going to last? I had a feeling about that.
It goes, I think, until the 13th. But then Mars is in retrograde, and that goes to like the 19th.
Yeah, but that's not as bad as Mercury. So,
well, let me take it from here, Anita, if you don't mind.
Okay. Well, I just want to make sure you talk about the book for a minute.
Yeah, the book is free to you if you call us right now, and it's a $25 book that I sell it for, and there are a couple hundred pages, 250 scientific studies on how platelets and stem cells can help you heal, and how you can grow hair with it, and how you can get more pretty, too. Men and women do the vampire facelift, which regrows the collagen in the face. So we know we can grow tissue. And, dating back to when I was in medical school, I used to get screamed at by my professors because I would talk about this stuff, and they'd say, you can't grow collagen. And the studies show you can. And I think doctors are kind of locked into their own tradition instead of moving ahead. And it's pretty sad to me that doctors are still doing all of these surgeries that are hurting people. There are many times when surgery needs to be done. I'm not poo-pooing surgery, I'm poo-pooing the surgeries. If you have a meniscal tear, which I've had on both my knees, don't get surgery. Try regenerative medicine. If you have an emergency, get surgery. But then there's a question. What is an emergency? My idea of an emergency and an orthopedic surgeon's idea are different. I often send my patients to an orthopedic surgeon for a second opinion, and they come back and they say the surgeon wants to do surgery right away. And I say, you have the option of doing it or not doing it. What's the word for that, Nita?
Elective.
Elective. It's an elective surgery. That means you can do it or not do it. If you're going to die from something, then that's an emergency. But most surgeries are done when they don't need to be done. And there's situations where regenerative medicine using platelets or stem cells can heal the area, and it's so easy to do it. I don't know why the surgeons are not doing it. I mean, I do know, but I don't want to get into the politics of medicine. So anyway, Tony, I hope you're still listening. You've got low back pain. There's tons of reasons for low back pain. The most common is from ligament laxity or ligament sprain. I know that many of you listening have had an ankle sprain. We just had Richard call up about his fiancée who sprained her ankle yesterday. Well, they're not running to a surgeon to get a surgery for an ankle sprain, right? Why are people going to surgeons to get surgeries for back pain or neck pain? I don't get it. What happens is often the surgeon or the primary treating physician will get an MRI it'll show something like arthritis or a facet arthropathy or a herniated disc or spinal stenosis. And none of these things are the pain generator. So people get a surgery. We had a question right in the beginning of the show with someone who had a failed back surgery. That means they had a laminectomy. They had some bone cut out of the back of the vertebrae, and they got worse, and then had a spinal cord stimulator put in and got even worse after that. Well, what's going on? The surgeon did the right thing according to the MRI. Why did the patient get worse? Because what the surgeon saw in the MRI or the X-ray or the CT scan had nothing to do with where the pain was being generated from. So I get people almost every single day, new patients, who come in and say they had a failed surgery. It could be anywhere: neck, back, shoulders, hips, toes, fingers, knees, and then we can get them better. Why? Because I use my hands to examine the area and find out where the pain is coming from. That's why. And I wish more doctors would use their hands. Many of the people that come in that have had a failed surgery, I ask, did the surgeon ever touch you? And they respond with, no, they didn't need to, because they showed me the MRI and where the problem was. Well, that's backwards thinking to me. My grandfather was a doctor born in the 1800s, and he didn't have MRIs. He didn't have X-rays. He used his hands. And you know what else he used? Placebos quite a bit. You're breathing, Nita. You have something you want to say?
No, I'm just fascinated when you talk about Grandpa. I just really think we've gone full circle here.
Yeah, I mean, unfortunately, he knew the truth. And he used to call, because I told him when I was very young, I want to be a doctor just like you. And he said, well, don't be a surgeon, because I said I wanted to do surgery. He says, don't do that. They're butchers. And, I don't like that name for surgeons, because today surgeons are the top of their class. It's a very prestige-y thing to be a surgeon. And they make probably the most money of anybody in medicine today. So they're the top of the heap, but they're still lost in tradition of cutting when they don't need to. And that's not a statement against the surgeon. It's just about the surgeries they do. I love surgeons. We need doctors to do the surgeries. It's just there's way too many surgeries being done in orthopedics that never should have been done. There's way too many failures. And if I fail, it's not a big deal, because I'm just injecting people with their stem cells or platelets. That's easy. If I fail, they just don't get better. Do they get worse? It's really, really, really rare that someone gets worse. Possible. Anything's possible. So, Nita, may I take a question here?
Let's do it.
While we're racking up the calls.
Do you want to give the phone number first?
Always. Phone number. Talk to me live right now. I'd love to talk to you. It's 866-870-5752. Please call me. If you want to get to the office to call, it's 800-300-9300. If you want to watch videos of what I do and see the injections of regenerative medicine, platelets, and stem cells, the website has these videos. It's www.lastemcells.com, and you can email me from any page on the website. So the question I have here is, let's see here. This one says wife's EDS. EDS stands for Ehlers-Danlos syndrome, which is a collagen deficiency problem. It's inherited. And what happens is we end up getting loose joints because the collagen, and by the way, collagen is the structural protein of the whole body. It's in our hair, it's in our blood, it's in our blood vessels, it's in our joints, tendons, and ligaments. So this gentleman doesn't talk about really what's going on with his wife, but I get people with this syndrome, EDS, all the time. And they usually just have loose shoulders or knees or some other area, and they have pain because of it. So what we do is we inject the area with platelets or stem cells, and that thickens up the tissue and can get rid of the pain and tighten up the areas. So it's very, very effective for that. Often we get people with dislocating shoulders. That's very common. And they've had surgery to tighten up the joint capsule. They don't get better. They come to me, and we can do that with just simple injections. And what the regenerative medicine does, using platelets or stem cells, is it stimulates new tissue to grow. It brings fibroblasts to the area. It has growth factors in it, and it grows and thickens the tissue up and can get rid of pain that way. Pretty amazing.
How about the phone number?
Yeah, why not? Even if you're driving, you can call me up. 866-870-5752. My name is Marc Darrow, medical doctor trained at UCLA, and I have been doing regenerative medicine for the last 25 plus years with amazing, amazing success. I'm going to go to another question here. It's about the hip. It says,
Okie dokie.
Imaging hip injections. Let's see what they say.
Did you give the website? Can I talk about that?
Yeah, talk about it. Go for it.
Well, the website's really cool. It's www.lastemcells.com. That's lastemcells.com. And not only can you email Dr. Darrow off of every page on the site, it's a very big, complex site with very, very cool videos showing Dr. Darrow performing the treatments on various parts of the body. So you get to see exactly, like if you have a knee problem, you watch him injecting a knee, for example. So, speaking of a knee problem, here's Herbert in Beverly Hills with knees.
Hey, Herbert, how are you? Dr. Marc Darrow.
I can't believe I got through, but...
well, God bless you, man. I'm glad you did. Thank you.
I am going to be 75 pretty soon, pretty active. I was pretty active. I've reached a point, I've lost a lot of flexibility. I have a lot of pain in particularly the right knee, but both knees. Played a lot of tennis, weightlifting, various sports, very active, hiking, and I can't play tennis right now.
Okay. What's your question? Can I help you? Is that the question?
Well, can you do the, I listened to you. I understand that this would be a chance to be beneficial. And I just was getting an opinion about that. Can you do both knees at the same time?
Yeah, I can do both of your knees at the same time. Theoretically, I could do your whole body in one session. And
I can barely hear you.
Oh, I'm sorry. Can our call person crank up whatever it is that needs to be cranked? Can you hear me now, Herbert?
A little better.
Okay. Well, I'm yelling into the microphone, so I think it's on the radio station's issue there. So, Kevin, please do what you can to up his microphone. At any rate, yes, I can do the whole body if I wanted to. There are people that have come to me and I have injected the whole body. It takes a long time. But to do 2 knees is very quick. You'd be in and out in about an hour. Most of that time would be your blood spinning, and the actual injections just take a couple of minutes. So, yes, I don't know if you're a candidate or not. That would be something that we would ascertain when you come into the office. If you came in for a visit, I would examine your knees. I would look inside with an ultrasound, see if you have fluid inside of them. And if you were a candidate, which you most likely are from what you're telling me, you just got wear and tear at the age of 75. You probably have a little bit of arthritis. That's pretty normal. And from all the years of pounding with tennis and hiking and all that, theoretically, if you think about it, you should have some knee pain. But it's like tires that wear down. In the old days, we used to retread the tires. And with regenerative medicine, we retread the cartilage in the knees and the meniscus. And just from what you're telling me, I think you'd be a good candidate.
The difference between the spinning the blood, and then there was another PRP.
Well, if you do, you could do PRP or PRP and stem cells. And the difference is, I'm going to do it in terms of what was your vocation, or what is your vocation?
You're fading away again.
What did you do for a living?
I am a pharmacist.
Okay. So let's say
I'm on my feet a lot. I walk a lot.
Let's say, theoretically, someone has a terrible, terrible infection, and they're septic and they're dying. Would you give them one antibiotic or two different antibiotics?
Well, I probably, if I was making that decision, I would probably culture it and see what the infection would be.
Oh, of course you would. But my point is this: you want to knock that infection out as soon as you can. And in most cases, if someone's dying, they're on more than one antibiotic. Okay? So let's not belabor the point. I understand you're a very smart guy and you're going to the crux of your work. But my point is this: if you use platelets and stem cells at the same time, you're going to get a better healing than just using the platelets alone. I'd have to examine you and we talk about it. Let's put it like that.
Okay. All right. Well, I've been listening to you for a long time. Years. I just finally.
I think the police are coming to your house right now. Do you hear the siren?
Yeah. Anyway, so
I can't get you to laugh, can I, Herbert? There you go. Anyway, yeah. There's a very high risk, if you want to call it risk, not risk, very, very high probability that we can get your knees better. And I'd have to examine you first. I do lots and lots of knees every single day of my life that I'm at the office, which is most days. I rarely take vacations.
One other question.
Sure.
I've spoken to other people, and someone mentioned I guess they were taking it out of the bone.
Yeah, you can take it out of. There's a lot of ways to do it, and if you want to call me at the office, we'll go over that in detail, or just email me through the website, which is www.
They needed an anesthesiologist.
No. I don't do anything that needs that. And the guys that do that are overthinking the process. It's very easy, no matter which way I do it. It takes me a couple of minutes.
I was wondering about that.
Now, doing bone marrow to get stem cells takes me, write this down, you won't believe it. It takes me about 15 seconds. I don't need anesthesia other than a local injection of lidocaine. It's so easy to do. I've done about 7,000 of those. If you get someone who's Johnny-come-lately or someone who wants to bilk the insurance company, they bring in an anesthesiologist, they take you to a hospital or a center where they're making tons of money from insurance. I don't do any of that. I've done so many, it's so fast, so easy. But there's a lot of ways to skin the cat, and if you get a hold of me at the office, I'll give you more information. 800-300-9300 at the office. And for those of you listening who want more information live from me, we still have a few minutes left. The phone number here to the studio is 866-870-5752. And Herbert, thank you so much for calling in. We appreciate you, and God bless you.
Thank you.
Herbert.
Thank you very much.
And the website is www.lastemcells.com. That's lastemcells.com. And the office number, should we give that?
Yeah, 800-300-9300. I'm going to try to get in a real quick question here.
Okay.
This one says, do you review hip, x-ray, and MRI? The answer is yes. Have you ever injected hip areas? Almost every day of my life in the office. Yeah, I did a bunch of them yesterday, I remember. And it's very amazing. The lady came in. She was very anxious. She had hip injection from another doctor. She said it was the most excruciating thing she'd ever had in her life. And I did hers, and she said she didn't feel it. So I use smaller needles. I'm very cautious about keeping people happy and not causing pain. And one of the reasons is I've injected my own body many, many times over the last 25 years. And I don't like to hurt myself, and I don't like to hurt my patients. So I was able to numb up the area of her hip before I injected it. She didn't even feel the injection.
That's pretty cool.
Yeah. Let's see. The clock is running close here.
Yeah, we got some time left.
One more.
Fit in one more call.
One more.
Sure.
This one says discomfort after meniscus. Person says, I had meniscus root repair surgery, left knee approximately 2 months ago. I'm experiencing a lot of pain around my knee. Not really physical knee pain, but it's more muscular pain in my quad just above the upper outside part of my knee, like a pulling sensation. Any recommendations? Yeah, I'd go back to that surgeon and say, what the heck is going on? You know, by 8 weeks, 2 months, you know, theoretically, there shouldn't be any more pain if you had a surgery. So you can come see me if you like. Number is 800-300-9300. We can see what's going on. I will touch the area. I will move it on, move it around, find out where that pain is being generated from. If I think you're a candidate for platelets or stem cells, we can inject you right on the spot. Very often people coming after surgery and they have pain in different parts of their body. They can have a back surgery and end up with neck or shoulder pain because when you're asleep getting a surgery, you're getting pulled around like a bag of potatoes, and you can be injured in other parts of the body too.
That's a scary thought.
Happens all the time.
Okay.
Should
How about
I?
that book?
I love that book.
That book is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. This is the book you will get if you call in the next 5 minutes. We still have time for your call. And you get this book for free, not even paying postage. That's free.
I like the free stuff.
Yeah, and it's got 264 scientific studies. How long did it take you to write that book?
Only 5 years.
Well, that's what research does take time.
You know why I wrote it, Nita?
To educate people.
I used to lecture at hospitals. I was a professor at UCLA, and I often went to other hospitals for their continuing education. And at the end of my lecture about regenerative medicine, there was always an orthopedic surgeon or two who would stand up and go, "Where's the research on this?" And so I spent my years putting together the research into a book. And now when they say, "Where's the research?" I bring copies of the book and I hand them out. And I go, "There's the research." Now, they could find the research if they'd look.
They could.
Yeah, it's all over the internet and it's in their medical journals. But doctors, for the most part, I'm going to use the word, excuse me, dinosaurs. They're trained in a certain thing and they just promulgate that. They don't move ahead into what the newest thing is that can be helpful and less invasive. And in medicine, the first law of medicine is do no harm. So surgery, unfortunately, I wish it were different, does a lot of harm to people, including me with my with my shoulder surgery. So I'm glad it happened to me. I'm sorry I had to go through it. I'm glad it happened because it let me know that surgery is not the answer for most orthopedic surgeries. That's a pretty blunt statement, but that's my humble experience. Well, God bless you all. Thank you for listening into the show. If you want to reach me at the office, it's 800-300-9300. If you'd like to watch me doing these procedures, there's videos on my website, www.lastemcells.com. God bless you, Nita Valens, and the staff.
And
Suzette.
thank you, Kevin, and thank you, Suzette.
Yep.
I'm Nita Valens. We'll see you next time.
Thank you.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. right here at AM 870 The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.